वो फार्मा इंडस्ट्री बहुत अलग टाइम का है
इंटरव्यू बोलो तो यूज तो थोड़े कील पकड़ लिया ना समझ कुछ गलत नहीं है So I'd like to give a brief introduction about who these people are.
Yes.
They are the startups who have been funded by Department of Industries, Government of Bihar. So Government of Bihar, initially gives 10 lakh rupees pre-seed fund, and once that is utilized, they give another 15 lakh rupees, which has to be returned after 10 years. So most of them have been funded by the Department of Industries. They are startups working in different fields. Some of them are working in e-commerce, some of them are working in. So what we do is we'll take a short introduction. So apart from these people, we also have around 20-25 people who are connected virtually. They are students from different engineering colleges. They are some of our startups who have also been funded, so working from their home. What I'll do is I'll request them to start अपना नाम introduction थोड़ा startup के बारे में वो क्या करते हैं experience sharing.
Hello, I'm Asif and I'm working in beverage field. My company name is Stop Making Private Limited. We're providing like Coca-Cola is providing carbonated drink and my drink is juice-based carbonated drink. We are different from others.
Oh, okay. I'd love to try it.
Okay. Yeah, it is.
Because Hankla is from the land of city of Coke.
That's where comes this from. So we have it everywhere.
Hi, myself, Mohammed Zaki Imam. My startup name is MSMEs Organics in the Private Limited. So we are working on honey-based products. We have different type of honey available, just like value added, lemon added, turmeric added, and we also making some different kind of foods from honey. We also have prebiotic honey that is not available in India right now. So first we have made it.
Oh, that sounds wonderful. Thank you. Nice to meet you.
Myself, Amit Kumar. My company name is 8080 Online Services and Consultancy Private Limited. We are providing like electrician, plumber. It is on-demand service.
Correct.
On-demand.
I mean, that's great. You need to do one thing well, and you are. So nice meeting you.
My name is Chotelal. My company name is engineer.com, especially green aggregate B2B marketplace.
Okay. So it's a marketplace that you set up. All right. Nice to meet you. Thank you.
नमस्ते मेरा नाम शीख है हमारी कंपनी का नाम है कलमबाग राइटिंग वेंचर प्राइवेट लिमिटेड हम लोग किसी भी कंटेंट को लिखने और राइट करने में काम करते हैं
बहुत अच्छा है ये अच्छा है सबसे बेहतर कृषि हुई
सर मेरा नाम ऋषभ है और मेरी कंपनी का नाम ओरिजिन स्टार प्राइवेट लिमिटेड है हम लोग सस्टेनेबल प्रोडक्ट पे हम काम करते हैं जो प्लास्टिक के प्रोडक्ट्स रहता है उस पे हम लोग काम करते हैं जस्ट अल्टरनेटिव इसमें हम लोग लाइफ स्टाइल प्रोडक्ट्स ये सारे ये जैसे प्रोडक्ट हैं
okay wonderful nice meeting
Namaste, my name is Nitin Tiwari and my company name is Metaverse. So we are basically building 3D simulation in virtual reality for medical residents. So we are based startup.
okay
Hello, sir. Myself Rashmi, and my venture name is Dhashra Limited, and it is into personalized designer footwear.
Hi, sir. My name is Kumar Singh, and we are building a platform which simplifies compliance for the directors or the public.
government compliance or okay great nice to meet you
Hi, sir. My name is Pintu Kumar. My venture name is Please Solutions Private Limited. The brand name is Agro-Kisan. So we are providing sustainable hydroponic water production solution for dairy farmers.
okay great
Awesome. My name is Rajkumar.
okay
Yes, sir. My name is Rajkumar Jaswal, sir, from water ATM production from last 2 decades.
all right nice to meet you
This is Yusuf. And my driving hobby. We are actually working on IoT-based sensor. Like we are going to prevent carbon. Any kind of
Fantastic.
Hello, sir. Myself is Kumar, and my started doing since we have kind of common. So having working, getting out of working really in the power industry, later on getting working in the industry, which one is, which is going here, supply chain management of the most effort get dependent of the generic machine, but 1% of the population of still part of it. The lines what to do for 30 years, it's very important. So, see all over my.
Fantastic.
I'm working there, sir.
Okay, that sounds really great. Okay, nice to meet you.
नमस्ते सर, my name is Utsav. The company का नाम है Hankla. We are dealing in micro beads and other liquid beads, which are very helpful for disease-free.
Okay, you said like seeds or?
We are producing micro beads.
Okay, okay. All right.
These are very small plants that.
Very small
flower
plants.
seeds.
Yeah.
They can be consumed. raw.
All right.
I have some samples.
Yeah, okay, sure.
Yeah, so
Hi, I am
Hi.
Sanjay Mishra, and my company is GPEX Logistics Private Limited, and we are doing B2B pharma logistic. We are doing daily refilling for the pharmaceutical medical stores, which is their requirement.
Yeah.
And my experience is in pharma industry. I was in pharma industry since.
this can be eaten raw.
Can be eaten raw.
Yes.
Okay.
So, and then you can have a variety of these seeds grown into these tiny plants.
So people buy it for their apartments
He's trying
or
to
their
just
homes or? Mhm. All right.
So we are doing daily refilling, and my experience of pharma industry in last 25 years, I was in pharma industry itself.
In the pharma.
Yeah.
Yeah, I know that's a huge
Yeah.
market,
Yeah,
huge
very-
industry there.
Yeah, very big industries.
Okay.
Hello, sir. My name is Rajat. My brand name is Kumod drinks. So basically, we are offering flavored drinks which are based on zero sugar, zero calorie, and zero artificial ingredients. And basically, we are offering fulfilling the gap between sugar beverages and packaging.
Hello, sir. Hello, sir. Myself, Avinash, founder of Vidha Tutor. So basically, we are creating a marketplace for tutor, working in personalized tutoring, where anybody can book tutors for academics, non-academic skills, trainers, and also we are just working on topic and chapters, and where anybody can book tutors for any topic and chapters, both offline and online.
Well, that's great. The coaching industry and tutoring industry seems to be very large
Yeah.
here in Bihar. I've seen a lot of ads and things, so you can connect
Yeah. We are
smaller.
trying to make it organized.
All right, wow, okay. A wide variety of different things.
I request to introduce Professor Charles Hankla. So you say.
Thank you, sir. Thank you, Kumod. And I'm taking this opportunity to introduce one of the towering figure in field of political economy, Professor Charles Hankla. Professor Charles Hankla is professor at Georgia State University, Sir of Political Science, and currently is heading as a director of the International Center for Public Policy and Professor of Political Science at Georgia State University, Atlanta, Georgia. So Professor Charles is in Bihar, and he is conducting a research on basically on the impact of education, health, and it's about the interaction of the government schemes and intervention of the public representative like the mukhias and the government representative like the videos, that how they are doing in their field, in the area. Is there any influence of their appeal in the particular village or the particular block? And even he's also working on the appeal of from the MLAs also. So and we are very happy that he because of him and because of the Kumodji, Bihar first institution, that is the Chandragupta Institute of Management Studies, Patna, entered in the memorandum with the Georgia State University. This is a very historical moment for Bihar because first memorandum of any university or any institution from Bihar with the any public institution in USA. So now we have opportunity to for the
faculty exchange program, and more than faculty exchange program, our students are getting benefited from this exchange program, that they are going for Atlanta for some semesters. So it's open a new open a new gate for opportunities. Like we all know that the USA is a land of opportunities, and our younger brothers are going for them. Yeah. So, and I know you all are here to listen more from the Charles. And before that, I just like to focus a little bit on his work. So Charles' PhD is on the industrial policy, and he worked during his PhD in India. Even he worked with, he interviewed so many personalities from the World Bank, IMF, and currently after that he just completed a project on the political behavior in Bihar. So the last project, and now his project is on the, which I have just mentioned, that it is on the education and health.
Do you want
Please
to
introduce yourself? So yeah, so I am Dr. Utsav Kumar Singh. I am fellow at the Institute of Social Sciences. Before that, I was in Delhi University. I taught there for the 2 year. I was a lecturer on economics there, assistant professor. Now I'm located in Nashville. I'm doing my own research, and I'm working on the welfare schemes, and I'm just looking at the puzzle that there are so many several schemes there. There are several schemes by the government of India, by government of Bihar, but still Bihar is one of the poorest among the one of the poor among the poorest. So why these things are happening? So I'm working on that to for the upliftment of the people and for the effectiveness of the government policy.
We also have the starter exchange program as a part of that.
Yeah. I hope so. Well, that's something we can look at. That's something we can talk about. Absolutely.
That would be great.
That would be great.
And I think nothing is impossible in the leadership of Kumod.
Yes, it's true.
Yeah, before we start the session, let me tell you, this is not going to be ordinary, a session like we had previously. So this is just an experience sharing, and then he will talk about his experiences, how startup does in other countries, and then how we can do, and then ask all the questions that you want to ask, right? So, sir, what do you want to share with them?
Well, hello, everyone. It's an incredible honor to be here with all of you. It's so impressive, all the things that you're doing, and it's exciting to hear about all the entrepreneurship that's happening in Bihar, all the different kinds of companies, from working on soft drinks and honey to e-commerce, everything under the sun. And I want to thank Dr. Kumar and CIMP for hosting me, and we had this wonderful conference last week, and I learned a tremendous amount about all the exciting things that are happening in Bihar, and I want to thank Dr. Singh for also being an incredible host. He's based now in the US, and we've known each other for a few years now, and he's been really an incredible entryway into understanding and learning about Bihar. So we just returned from a week of field work in Gaya district, where we visited 5 or 6 different villages, and we met with Mukhia. We met with regular villagers and focus groups, people from all different backgrounds, from Mahadalit communities, OBC communities, and so forth, and kind of learning how they're interacting with some of the government schemes, in particular Ayushman Bharat, which we're particularly trying to understand the uptake of it and how effective it's been. As Utsav said, I'm a political science professor, political economist, and I've been at Georgia State University now for 20 years, I'm a professor there. And I lead our center there, International Center for Public Policy. We work primarily in public finance. And so we currently are working on 2 World Bank projects in Africa, on rethinking the fiscal arrangements between the center, the province, and local governments in Mozambique and Cameroon. And we also are working in Nepal with the Ministry of Finance there, looking at the transfer systems from the central to the local governments in Nepal, and doing another project in Jordan. And so I also have kind of an additional interest in industrial policy. My first trip to India, I came in 2003. And that was researching my PhD dissertation. I lived in Delhi for a time and had the opportunity to meet with folks from the Planning Commission, as it was then. This is obviously before the Niti Aayog came into being, and with other individuals who generously, people like Montek Ahluwalia, Arvind Subramanian, and others who gave me time to learn about how planning functions and has functioned in India. And I've continued to work on that along with local government, an interest in local government. I should say I'm not an expert at all in startups or small and medium sized industry. So I just want to say I have much more to learn from you than you have to learn from me, especially on this subject. I really do want to hear what your experiences have been. In industrial policy, my work has mostly been looking at the government side and also looking at how institutions interact in government promotion of business. And so one of the arguments that I made, I've got a book coming out in a few months that looks at India, but also looks across countries. And one of the arguments that I'm trying to make is that governments can really promote economic upgrading, but it's a tricky thing to do. It's hard to do, and it has to be done with a great deal of care, because there's the risk on the one hand that the government will be captured not by small businesses, but more by large businesses like your Tatas and your Birlas, Reliance, and so forth. And that if those companies become too powerful, then they can dictate state policy, and that interferes with the market. It makes it harder for people like you to create your own businesses, because the economy is dominated by these huge conglomerates. The flip side, oh yay, I love money. I'm very excited. Thank you. The flip side is if the government becomes too powerful, then the government sometimes can interfere with the functioning of the market, do things that are inefficient. We only have to look at the license and permit laws of the past to see an example of this in India, and there are many examples in other countries too. And so what I argue is that a cooperative relationship between government and business within a market system can function if both sides have due respect to one another. If there's quality information flow between business and the state, so that the state understands what businesses need to be competitive and can provide that, and at the same time so that state maintains kind of a broader picture of the economy and isn't totally controlled by any individual business, so that there's a mutual respect. And the way for governments to think about this is not to think of their role so much as regulatory, businesses have to do this, 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 and this, and fill out this paperwork and so forth, but more as a form of, incubation, kind of like what CIMP is doing, supporting businesses. Yes, regulating them as well when necessary, but supporting them in their journey to become more competitive. And I think, in a country like India and also in the US, large countries with federal systems, there's a role not only for the central government in doing this, but there's a role for the state governments in doing this as well. Because in a place like India, the central government it's just too large for the central government to be able to do all this effectively by itself. And this is also true in the US. One thing that I'm starting to get interested in and work on is kind of how do subnational governments like states, what role do they play in industrial policy, and how can they coordinate with the central governments in supporting business to become more competitive, so that the two sides are not interfering with each other. Because you sometimes have a situation where states all trying to attract investment, compete with each other, and it's not very helpful for the economy. If Gujarat and Maharashtra go to the US and they both try to attract investment, then they're spending resources to fight against one another, and from an all India perspective, that's not efficient. And so how do governments coordinate? The same thing happened, something similar happened in my home state of Georgia, where Georgia and two neighboring states, South Carolina and Alabama, fought over. Oh, yay, I'm getting a lot of wonderful things today. Um, fought over investment, a BMW plant. They all wanted BMW to set up a huge manufacturing plant, and they all provided tax breaks. So Georgia said, if you come to Georgia, we'll give you, you know, $3 billion of tax breaks. And then South Carolina said, well, we'll give you $4 billion. And eventually they landed in South Carolina, but in the end, South Carolina had to pay something like $200,000 in tax breaks per person hired, right? So this kind of internal competitiveness is inefficient in many ways. And so at the same time, excluding state governments from supporting businesses is also not ideal. So how can state governments play a role while also not engaging in this kind of inefficient competition with each other? How can they coordinate with the center and things like that? So that's an area of interest to me. As I said, I'm no expert on businesses themselves. We actually have we have a very good business school at Georgia State, and it's called the Robinson College of Business. I'm in the public policy school, and so we're working more on the government and the public sector. But the business school does do entrepreneurship. The very strong business school. We're located in the center of Atlanta, and Atlanta is America's 8th largest city. We have 6 million people, and we are kind of a business hub for the southeastern part of the U.S. So we have the headquarters of of Coca-Cola, Delta Airlines, Home Depot, and a number of banks and things. So there's a lot going on, and I'm hoping that there'll be opportunities to do some exchanges. I'll talk to my colleagues in the business school in particular, where they are more kind of expert at entrepreneurship than I, and we can see if there are opportunities to get things moving. But I want to thank you again for kind of introducing yourselves and sharing all the wonderful things that you're doing. And I'm hoping I can hear more from your experiences so I can learn more about what's happening here in Bihar. Yes. And I'm going to try this. All right.
Is there someone your experience about Bihar's ecosystem, the startup ecosystem, and about Bihar's startup policy? Please share someone your experience to Professor Charles Hankla.
If it has what I have understood, that you are working as a catalyst between the state government and the central government in India, because India is a democratic country where constitution has a framework of federal structure. So there are many policies which are already designed by the government of India. Like we are talking about the Ayushman Bharat. So which has been designed to target the rural population of India, which consists of the three kind of rural household, that is deprived, rural, vulnerable household. Second is the non-deprived, vulnerable household population. So how you have been contributing in finding those household in there, since you have spent your whole time in there. So how you have been able to find those household who deserve to get the Ayushman card?
Yeah.
So you are trying to know about the effectiveness of the card.
Yeah. Now, how you have been able to
effectiveness of the
find the houses that need that.
How many kind of parameters behind before distributing this card?
Yeah, it's so on this particular card. I mean, one thing that's really striking about the Indian case, and when it comes to schemes like this, Yojana like this, is that, and the US is actually quite similar. You have the welfare state in India consists of all of these different schemes. So the central government will notice an issue and it will create a scheme to fill that issue. So you have the bicycle Yojana, you have the Ayushman Bharat, you have numerous other schemes that encourage girls to graduate from high school, or they might encourage people to go to primary health clinics. And so it's a complex public policy environment. We have the same issue in the US. I think from a broader perspective, it might make more sense to consolidate some of these yojanas so that individuals could better understand what they're entitled to. One thing that we noted in our field work is that a lot of people in the villages, some have heard of Ayushman Bharat, some have not, but those who have heard of it are generally, in fact, unaware of what their rights are under the scheme. Sometimes people believe that they have an Ayushman Bharat card, but they actually have a card from another scheme that's unrelated to Ayushman Bharat. So a lot of people complain that, hey, we did sign up, but the card isn't working. And then we would ask to see the card, and it's not an Ayushman Bharat card. So there's a lot of communication problems that exist at the village level, where either people don't know about the scheme, or they've heard about the scheme, but they don't know what it does, or they think they've signed up for the scheme, but they actually have a different card, which is for a different scheme. And there's also a lot of mistrust, because a lot of people who know more about the scheme believe that the impaneled hospitals where you can use the Ayushman Bharat monies, the PMJ monies, are inferior. They're not very good hospitals. We'd rather send, if we have an emergency, we'd rather send our family to private hospitals. And so there's also some distrust of the impaneled hospitals as well. So all of this is really interfering with the effectiveness of a scheme that on paper is very powerful. I mean, 5 lakh rupees to everyone for, serious medical care is, an incredible investment. But on the ground, at least in rural areas, it hasn't really been implemented very effectively. Not for lack of trying, but it's hard. It's hard to do. And so that's one of the things that we're discovering. One of the things we're trying to do is figure out how can the government get the word out better, and get people to trust that the scheme is working. So that's one reason we and I know this doesn't have a lot to do with incubating small and medium-sized industries, but one of the things that we did was we recorded statements about it from MLAs, from Mukias, from BDOs, encouraging people to sign up, and we're going to be distributing those statements around and trying to follow up and see whether people are signing up for the program. So I hope that answers your question.
Thank you. Thank you.
Sir, do you have any process to evaluate the user of the card?
Process to what? Sorry.
Evaluate the user of the card.
You mean whether or not they're actually using it?
Yeah.
We can only ask what people are doing. I mean, it's a challenge of this kind of research. Obviously there's privacy issues, so we're not able to ask the government, how much money has somebody used on their card, which is reasonable. People have a right to privacy in their medical information. So what we do is we ask, we're doing 4,000 respondents. This trip was actually just a preliminary trip to talk to people. But we're going to do a more systematic survey of 4,000 respondents in Gaya, Jamui, Madhubani, and Supal. And in those 4 districts, we'll go door to door and just ask people, have you signed up for the scheme? And then if they haven't, we'll play them some of these messages, and then we'll see if they want us to assist them in signing them up. So that's what we'll do. Probably we'll ask people to show us their cards if they say that they've signed up, just so we can verify that. But of course, it's totally up to the respondent whether they want to show us their cards or tell us, whether they've used the program or not. So if they say, oh, we don't want to tell you, then that's okay. We just move to the next household. So
one more question, do you have any law actually in case if they are getting manipulated?
If they're getting manipulated, you mean by false schemes? Or there was, so we haven't seen that, but we have heard concerns about manipulation. Some of the respondents felt that if they used the card, that the hospitals would charge them for more expensive procedures that they didn't have, and then pay themselves. So we had some respondents say, "Oh, if I go to the hospital, and I use 1 lakh rupees, then the hospital is going to say that I use 5 lakh rupees, and then they're going to get paid, and then they're going to pocket the 4 lakh rupees difference." And so I don't trust them to do. We've heard that a few times. Whether that's happening or not, we don't have any evidence of that. But I know some of the respondents are worried about things like that.
We are not having a specific law for that. If anybody is doing something like that, they're forging the document or charging more than the actual treatment charge, then he or she can be treated by the existing laws of the law. Plan.
We are getting hurt from many of the people are hurt from, okay, they are getting, they are saying like, he's hospital and they went to hospital and they have like a manipulated test, okay. They ask them to pay this much amount and then after the rest of the thing, they will do that. So, okay.
And we also heard about these things in a village when people are saying that we go to the Adobe and they charge us more than the actual price, and even after 1 month, the patient died. So we are not having any specific law to deal with this. If anything is happened in hospital or with any patient, then he or she or the any culprit will be treated by the land of law, existing law.
There should be some more awareness around this.
Yeah. So the main motive of the project, the CHARS project, is to awareness. How people are aware about the government project, government schemes or not, and what are the methods which we implement, what intervention we develop or we formulate to get people more know about these schemes.
Only with Ashman, I wanted to say like instead of going door to door, we have like just went to the panchayat, right? There are in some kind of sammelan and meetings actually, okay, and then you can address these things, okay. In a single meeting, you can address to many people.
No, that's true. Yeah, I mean, in some of the villages, the Mukias are tremendously, influential and respected. I think in others, maybe less so. There's some variety in terms of how Mukias are thought of in villages that we've seen. I'm guessing you've experienced that too. Part of why we want to go door to door is to get kind of, because we'll be doing a quantitative study in the end, and so we want to randomly interview different households in order to kind of see what sorts of messages are working better. But we have done these large groups through the Mukias in the last week to kind of get a little bit more conversational with people and see what it is that's impeding their ability to sign up. But maybe there's a room here for the private sector to play a role in connecting people in the villages with schemes. I mean, and it would be interesting to think about how a company or a civil society actor could try to bridge the gap between schemes that are really quite generous, but people don't know about them. People and the government offices are overwhelmed and not able to really communicate. Maybe using technology. I mean, one thing that's really striking to me, and you know this already, being from the cars, that everybody has a cell phone, or at least every household has a cell phone. Even the poorest households, even in the interviews we did with Mahadalits in a community, all the households had cell phones. So this is an opportunity to communicate to people about the schemes, how to sign up for them, and things electronically in a way that wouldn't have been possible, 10 or 15 years ago, I think.
And one day we can see that from this entrepreneur will forward and build an app for that.
An app, yeah.
Having this usefulness of this schemes and people benefited or not.
Like
So
the training app.
Yeah.
So the training exchange, tutoring exchange app, maybe it would be possible to have something that the government has these things on the websites, but government websites are not always the easiest to use, of course, and there's so many schemes. I mean, I have had a really hard time keeping track of the different schemes. And I know that someone in a village who doesn't do this professionally, someone who may be illiterate, is, if it's a particular poor person. I mean, to keep track of the dozens of different schemes at the state and central level are hard, and it would be interesting to have some sort of an app that could say, okay, enter your information and here are the schemes that you're eligible for, and click here to sign up for these schemes. Yeah. So people know, oh, I can sign up for this scheme because I have a ration card, but I can't sign up for this scheme because it's only for people in this category. But that type of a thing, because it's complex. It's really a complex policy environment to navigate for people.
There is a
And
gap.
itself is a very complicated process. Even if you have awareness, it's very difficult to sign up for it. But our health tech, I mean, there are a lot of startups who are working in the domain of health, so they can take up this responsibility and they'll simplify the entire, knowledge and awareness and various schemes.
Yeah.
Once again, sir, I am trying to throw light on the healthcare system prevailing this year. Since you have been in India for long, since 2003, and in system, this is prevailing based on the population and the that is why Indian healthcare system is based on the healthcare system, which is primary healthcare system. So it's very popular. And when we talk about the public healthcare system, which is categorized into the primary healthcare system, secondary healthcare system, and tertiary healthcare system.
Yeah.
When we talk about this, this is the data. Person what I am from or so if it's kind of but is not same to the overall in the population. So this kind of things may arise in India, and which is really because we give the example of scheme, central government scheme. I just want her, which is designed under the PMGAY, we done out of Yojana. So I am giving you the example of the same scheme in Pradhanmantri you look at since this is a scheme of Manmohan Singh government in 2008, it was designed by the Manmohan Singh, but it was rebranded by the Modi ji in 2018 as the name as a Pradhanmantri Bharatiya Jan Aushadhi Kendra. Since the inception of this policy, when we have reached only 11,000 I in India across 20 states and 8 union territories, there are 6 lakhs private candy shop. So where we stand, and we are able to fight in the pharma segment because looking at Indian pharma domestic market in the retail pharmacy market, there is a huge number of private pharma candy shop. So how do you think that there is a problem with the state government also implementing the policy, especially according to the Jan Aushadhi Kendra? Why not? So we have been opening now across the state. So there were somewhere the structure of the state, which give them power to monopolize their rights in playing, implementing the particular policy. I'm giving an example. My startup is based on the rural population, and I'm working on the landscape study in India because its journey of economy in 1990 when the customer was here. And the Lancet took the study from 1990 to 2020. Within 30 years, there is a lot of things, taking place in India.
Yeah.
And I think it's supposed to be the data of the medical science. I think since you are in the research field, you are quite aware about the Lancet. And in 2022, Lancet published its report. And the study was carried out to find whether healthcare distribution has been increased in India due to the economic development or no.
Yeah.
Yes. Within the 30 years, healthcare distribution has been increased, which has been noticed in the eastern part of India, which is the highest in India.
Right.
And due to which the prevailing condition of rural population 31% and 34% urban population are suffering from metabolic non-communicable irreversible diseases like hypertension and type 2 diabetes.
Yeah.
And out of 38 districts in Bihar, if we are looking at the socio-economic caste census population of 2015, each district consists of not less than 3.6 million population suffering from hypertension disease. So how we can tackle? Since medical treatment has become very expensive in India.
Yeah.
For targeting those employment cost of treatment, the Rosti has been now in India. And I am pursuing my career in bringing university organic medicine to the and the doorstep people who are suffering from the either hypertension and type 2 diabetes in the rural population. Looking at the type of rural household, there are homes deprived vulnerable household or non-deprived whole household or non-deprived household, single individual population. They are living in 45,000 villages in India. It consists of not less than 3.2 crore population. India, and if you calculate the total population out of 3.2 crore, almost it comes to 6 lakhs population. In which the private pharma company are making money like anything.
Yeah, that's a complicated. Do you want to tackle
Yeah,
first, and
yeah.
then I'll say.
So when we are talking about the health infrastructure, we have to look at the social and economic condition of the people. When we are talking about the health infrastructure, at the same time, we have to talk about the education level among the people. So the health infrastructure in India is very efficient, but not effective. So we are having the hospitals like AIMS, even in the private sector, we are having so many good hospitals, but they are not accessible by the poorest of the poor. So why government is giving this type of scheme like the Ayushman Bharat scheme, welfare scheme that's a part of the social security system. So why government is providing this? First, we have to look at this. But people are not having the affordability because people are not able to get treated if they get infected or get tested for any serious diseases. So government is supporting them in the treatment process as well as any further treatment. So first thing is that we have to focus on the education sector, and then we have to focus on the economic sector. So for that, once we achieve a certain level of education, then we go for any decent job. The purpose of this interaction session is also that impact of MSME in emerging economies. So we know that we all are working, and our government is also very serious about the decent job. That more than almost 90% of Indian workers are working in the informal sector, and now we have to achieve that we have to reduce this rate by 0% by 2030. That some of the workers in the formal sector. So once they get into the formal sector, they are going to get good salary. They bring good money to their home, and they spend more on the health system. And at that time, we can expect that this schemes could do better, because now they are not having a single penny to go to the hospital. The money which they are getting from this scheme is after entering a hospital or entering on the bed of the hospital. So this is the main problem. So when we are talking about the hinterland of Gaya, hinterland of Madhubani, hinterland of any district of Bihar, people are not having money to go to the hospitals, and even they are not aware about in which hospital they're going to get treated for the kidney, in which hospital they're going to get treatment of the cancer. So education is the main thing. Education is the main thing on which we have focused, and even our government is very much focused. And this is a very good thing that come up in Bihar under the leadership of Kumod. This incubation center set up. Otherwise, 5 years back, we are not able to think about this type of center in Patna or in Bihar. So when we are talking about this thing, effectiveness of this thing, and the out-of-pocket expenditure on health of India. In India, we expend more than 50% is covered by the patient or the patient family. So whenever anybody is get detected for the cancer, suppose that a cancer, we all know that if anybody is get detected for the cancer, he the same time, he also know that okay, the cancer is not. I'm not going to get rid of this cancer, and this cancer take my life as well as my property as well as my savings. So he's not going to the hospital. So this is the main problem. So we have to focus on first on the education sector and then on health sector. Then only we can see the prosperity of our state, our family, or our nation.
Well, I'm from Madhubani, and I'll tell you the problem with my village is most of these, these women, fall sick would never be accompanied by their husbands, right? They're also never go to the doctors along with their wife if they ever fall sick. But the problem is these women go alone and then visit the doctor. They would not dare to sit on the chair, they would be sitting down and then they're, and it's covered with their sari all the time. And the doctor has to ask, okay, what is the problem? You have to ask, you have to show, and then only, and in most of the cases, they'll not be able to tell their problem. I'm having this problem, and there are a lot of social taboo. They're not talking about any hygiene or menstrual cycle or all these things. They're not talking about this. These are some of the basic things that are happening in villages. So,
and I think this all gone by the increase of education level in the women or increase of education level among the men also, and empowerment of women also.
Yes.
I mean, this is such an important and complicated question. And trying to understand any healthcare system in any country, especially one as complicated as India is, I mean, there's so many moving parts. Our project is primarily about getting the word out about this scheme and trying to understand how to do that. But that's only a tiny piece of the overall puzzle. If you ask the broader question of how should the whole system be structured, my sense is that the bigger problem in the villages is not access to tertiary, medical treatment, but it's about the primary health clinics. And from what we've heard, a lot of times there's a very high level of absenteeism in the primary health clinics, so that doctors may not actually show up, and they might be closed when they're supposed to be open and so forth. So there's that kind of a huge problem, which every country faces. Somebody goes through all the effort and training of getting a medical degree, and then they are posted to a small village somewhere, and they don't want to be there, and they only come once a week and that type of thing. And the government salary is low, so then they can kind of sell their skills on the private market and make more money and that type of thing. And the same thing happens in the education sector. And how do you deal with that? I know the government now has kind of biometric scans to make sure that people show up, and it's a problem that I think government has become aware of and is trying to do something about it. But yeah, in my mind, having quality primary care is probably the most important thing, so that people can get diagnosed with things like diabetes or high blood pressure or whatever, and have access to drugs for those things. The Ayushman Bharat scheme, the side of it which is focused on tertiary care and the payment of the 5 lakhs, I can't think of another country that's done something similar, where the poorest of the poor have kind of a certain amount of money that they can take with them to a hospital. It's very interesting kind of welfare scheme, because on the one hand, it's universal, or at least it's open to everyone who has a ration card. So it's very broadly applied. On the other hand, it's a very market type of scheme, because instead of, let's say what might happen in the European welfare state, instead of people having free care for cancer or whatever it might be at a particular local hospital, they have a certain amount of money that they can take to multiple different hospitals. So it's the people that envisioned the scheme clearly had kind of a pro-market type of approach in their minds. Well, let's allow the market to work, and then the hospitals will compete with one another for patients using the Ayushman Bharat money, and that type of thing. The problem is that if you have a very serious, the scheme is only for people who have serious illnesses, but if it's very serious, you're going to run out of the 5 lakhs. And then you're not going to have any more treatment, if you have cancer or something very serious. And so it plugs a hole in between primary health and very serious diseases. And it has a role to play there, but I think paying attention to the primary health more, and then thinking about what happens when you run out of that 5 lakhs is part of making everything work together. So, but I don't have any real answers. It's a complex situation. In my own country, it's extremely complex as well. The mix of private and public and everything, the insurance markets.
Currently, what are the means of communication to aware the this for the Ayushman Bharat and Jan Aushadhi Kendra?
The means of educating people about Ayushman Bharat. So I think what often happens right now is that it passes through the BDO and the Mukhia. And, if you have a very effective Mukhia or very effective representatives to your Gram Panchayat, then they should communicate that to you and help you sign up. And we encountered some great Mukhias who were doing that, going to communities and saying, hey, you have a right to this, let's sign up, let's help you sign up for that. But in the poorest villages, I think people are very much dependent on the quality of their Mukhia and their local leadership to get the word out. If you have a very effective Mukhia, then that's one thing. If you don't, that can be another thing. Because the BDOs and are they're looking at they might have 1 million people in their block, or have the means to kind of get the word out. So there's a word of mouth and there's a panchayat function. And so what we're doing is kind of trying to see, we're dealing with a trust question. Who do people trust? If we play them a message saying sign up for this from the MLA, from the Mukhia, from the ASHA worker, who is most likely to influence them? I should mention the ASHA workers also play a huge role in this. Yeah, the ASHA workers, very impressive in the villages that we saw. The ASHA workers know everybody, and so they play a very important role too. You want to add anything?
I think in that which also we can see that the intervention that which is more effective, which is more appealing, that the message from Mukhia is appealing, or message from video is appealing. That it's about the and just you mentioned that issue of trust.
Yeah.
That who villages on they are having trust with on Mukhia, or they are trusting this video, because video is a government representative and Mukhia is the person to whom they are dealing on day-to-day basis.
Right.
So which appeals work. So this is also
we're also trying to understand that to compare expertise, which is with the BDO, to kind of familiarity and trust, which is with the Mukhia and the ASHA worker, and also kind of looking at the local versus state, the panchayat versus state level with the MLAs, and kind of seeing, how can the word about these schemes get out most effectively. Yeah.
The session got more focused on.
I know, and not on small and medium sized. What have been your experiences in setting up a business in Bihar? Has it been is the policy environment to do that challenging? Has it been streamlined? Have you found it easy or difficult to create a small business here?
So I think we are more happy to listen about these opportunities and challenges, because we are having this new type of ecosystem which is first in Bihar, this BHub. So what type of challenges, opportunities are there?
Initially, we cannot thought about this type of ecosystem. So I was thought from last 5 to 10 years before, but I could not come in this startup. But when I got information from these things, what are the ecosystem developed in Bihar? So earlier I thought from I start with either from Delhi or Pune or Bangalore. But when this ecosystem has been developed in Bihar, then I thought I basically belongs from Bihar, so why not I start from this place? So I have started, and I am happy with that. Now these days, day by day, enhancement is there, improvement is there. Though it is challenging, but it is improving. And by support of like CIMP and Bihar Industrial Department, they all are very supportive. I cannot expect the government is this type of support by government. It is easy, but now this is very easy. Anyone can who thought he can come and very easy he will enter in this segment in a startup ecosystem of Bihar.
And we are also very surprised that entrepreneurs are getting the seats in just 15 rupees, 1500 rupees, 1500 rupees.
I mean, there seems to be a motivation on the part of the Bihar government. It knows that Bihar is a little bit behind in this area, you know, that people think about Gujarat or think about Maharashtra, or they think about Delhi. And so there's catching up to do. And so maybe I hope that's benefiting you all, because the government is, you know, if you went to Bangalore, you'd be 1 in a million people, and the government probably wouldn't really care that much.
On the
But
favorable
here, you know, the
systems.
government's like, we want to support you. Is that right? I mean, is that what's happening? Or
I think out of 30 incubators in Bihar, since the inception of Bihar is in Bihar, I think we should give heart to life to a few incubators in Bihar in which CIMP is the front runner spending already. And no one thought will do like it and then thought of this kind of things that get and this kind of to get people like you. And this is the CIMP, and my thanks to CIMP people, they have been wonderful job. Yeah.
Do you think the time has come for Bihar to shift from the traditional education system to the more quality education, more technical education, and more this type of B-hubs in the other emerging cities of Bihar?
I can we did this kind of things. Last year we had a from the angel investor, Mr. ICePP. Yes, he happened to be the one of the top startup in the world now, and he's actually we are very lucky to get the opportunity to have the interaction with him or to go ahead in a startup. What do you need to do? So this kind of interaction, we are able to getting the opportunity, and we are happy and space over there. The Singh of Kumod sir and sir or Rana sir, everybody. Yeah, thank you.
Every week we are getting some input mentorship from this arranged by CIMP in this P Hub or in CIMP also. We are calling there from CIMP come and see and we discuss about our problems and solution. For every problems, there is a solution by the CIMP, which is in first incubation center here. And this definitely enhance our good support. And this will leads to many of the startup to go in high.
I'm guessing there's a big role is not
Yeah.
just the information, but the networking.
Yeah.
You all support each other. You know, I'm guessing. I mean, that
Learning from each other.
learning from each other,
Learning from
each
the
other's
expertise of
problems.
each other.
Yeah. And previous CIMP businesses that have become large and have grown, like the ones that we learned about at the conference.
Yes, I never studied in CIMP. I didn't got the chance to get admission in CIMP. But whatever scenario is going on, every weekend sessions are going on. I thought I was still students and learn from there. I go to CIMP. Regarding policy, I was asked by in Bihar in the previous policy and getting too much struggle on last 6 months. When the policy has changed, like 2022, I got the seed fund many times within the 20 days. The policy is changed, everything is like on the way to improve the structure.
So when did the policy, when do you think the system opened?
22.
2007 to 2012, we have started policy one.
Right.
And it was.
So when the
Next
Nitish
phase of-
Kumar came,
Policy is very flexible, right?
in the 2006 election,
Was
then,
in both the terms.
Yeah.
And started policy one also, but in two was more systematic. Now, when you get the funding in period of 30 to 45 days, you apply. The best part is you can apply on the ideation level. You don't have to develop a.
First, they build the infrastructure, then they create, expand it, and second phase, they implement it and they get it to
And- And we never thought that our office is like in a post area, we have Murialo, because in Murialo, the post area already there. Like, and that it's a dream of our staff. All are the fulfilling the day.
that's exciting, yeah.
I have a question. Like, we had registered as the MSME, in MSME, but what are the intimations and what are the benefit as a startup we are getting? We never find the further process of it. So, is there any kind of approach or any kind of government initiative will be taking for regarding MSME?
State funds.
Like,
Georgia Tech from USA, you might not be aware about the MSME policies that's happening here, right? So I request all of you to
You
ask.
can meet us separately.
I'd like to learn about it. But yeah, I don't know enough to be able to answer your question, but maybe Kumod knows the answer.
Yes, yes,
When
you can.
And if we are talking about the MSMEs, that what benefit you are going to get, that when you register for the MSME, that means you are formalized your startup. And when you are in the formal setup, you get all the benefit from the government, which you are supposed to get from the government. So that means you are covered by all the government schemes, all the government's benefits, all the government incentives. So that's the only thing which is going to get covered.
Section on MSME and the.
Yeah.
YouTube of the page,
CIMP is host institution for MSME also. You can meet us separately. Describe.
So I have a question. You mentioned the need of an app where pigeons can enter their dishes and the app will provide their expert. So should only the government make this kind of app or any chance of private players to make this kind of app? My concern is the private can make this kind of app. But then the citizens trust providing their details. So how do the trust it?
Yeah, that's a good question. I was just kind of coming up with that as a thought. I don't know how practical it is. But perhaps, I mean, if you could potentially pitch it to the government and have a contract from the government to pay for that sort of an app rather than kind of launching it privately with advertisers and that sort of thing. And that way you would have kind of the official imprimatur of the government of Bihar, maybe working with their services, but I don't know what, I guess they put out the government of Bihar can put out a tender for something like that. I don't know how practical it is though.
Yeah, they can do it.
Yeah.
We will have to get in touch with different departments, like they can do that. They can tell them that we're doing something like so they're building an app.
Yeah.
Which promotes all the schemes. Because gradually they'll have to propagate themselves unless they do not create awareness about themselves. No, going to them. So one thing that they're
Right, without, yeah.
All right, so we got limitation of time, so I will wrap this up here. So I'd like to request Kumod to present a small vote of.
And this was excellent, by the way. Is this whose company was it again?
Yeah, Talk.
It is yours. Okay.
So a small
Oh.
token of appreciation.
Oh, wow, thank you. Thank you all so much for taking the time. I know you're busy entrepreneurs, and it was really wonderful to hear from all of you.
Thank you so much, sir.
Oh, that's wonderful.
It's lovely having you here, and this has also been created by one of our startups.
Yeah. Okay. That is beautiful. Okay, so we're having the banyan tree, right, at Mahabodhi Temple. Yeah, we went there a few days ago. It was
It's a people trees, actually. It's